So, moving on to LSD. So, lysergic acid diethylamide, for those of you who haven't sold out to Big Pharma. No, so yeah. No, it's just LSD. It's acid, okay? So the problem with this is that it has a heavy sympathomimetic component to it as well. People often come in tachycardic. They're kind of amped up as well. This drug is actually associated with coma and respiratory arrest. It's not clear why, exactly what that is. But it's very easy to overdose in huge amounts because the way that people take this drug. We'll talk about that more. It can last up to 12 hours on a single dose. The well-described flashback phenomenon of months to even years later, people having recurrent hallucinations, is real. It's just a question of how common that is. It doesn't appear to be very common, but it's certainly the case. And it is very terrifying that it's possible for you to take something and then even decades later have unwanted flashbacks of issues. So blotter paper, okay? This is how most people are taking LSD. It turns out that it's often in like a liquid form, but no one is out there with like teardroppers. They often put it on stamps or stamp-like things, okay? And these stamps are often heavily marketed because it turns out that drug dealers are excellent at marketing. And so they put crazy photos and stuff on them. People either put this under the tongue and let it dissolve and spit out the paper, or just chew up the paper. They do it either way. People debate about whether or not you should eat the paper. I had a very enjoyable Google search